So when should probiotics be considered? There's many websites and articles. Many indications are suggested by current research. Some of the more frequent applications in the use of probiotics, of course, irritable bowel syndrome, inflammatory bowel disease, colitis, and Crohn's disease. People who suffer with C. difficile colitis, which is a bacterial that can invade the mucosa lining of the colon in hospitalized patients. Patients who develop antibiotic-associated colitis, where many doses of antibiotics for different infectious problems usually end up with diarrhea. Is it a side effect of the antibiotic, or is it really the fact that the antibiotic is changing the gut flora and now you have diarrhea because of a dysbiosis and affecting the bacterial imbalance? Some of my patients have had frequent urinary tract infections requiring frequent antibiotics, lung infections, bronchitis, sinus infections, and we see this all the time. Reoccurring use of antibiotics affects the gut flora. They get change in bowel movements, diarrhea, and here's a perfect opportunity to reestablish the good probiotic bacteria in the gut with probiotics. Women with frequent yeast infections seem to get a benefit from probiotics use, as well as reducing the severity and duration of the infection, and many times arising ironically from the use of antibiotics. So vaginal yeast infections. The take-home message seems to be that if you have adequate intestinal probiotics, you will have a more fit gut immune system to be in better shape to defend yourself from the constant attack, if you will, of the sometimes delicate bacterial balance in the intestine. And balance has usually been connotated with good health. So I'm frequently asked, if I eat yogurt every day, will that be enough to keep my probiotics in good shape? And unfortunately, yogurt, even with more probiotics, rarely has enough colony-forming units to be ingested in yogurt found in our food stores today to affect a significant change in the gut, especially when you're already dealing with a deficiency state or already suffering with some of the symptoms of a deficiency state, such as diarrhea or a significant IBS. So most people need to take probiotic in capsule form or powder form for at least 6 to 8 weeks when they begin to, where they're in need of real supplementation in order to get the desired effect at the level of the gut. So of course there's nothing wrong with yogurt and the probiotics in the yogurt, but that's more for maintenance when you already have an adequate intestinal probiotic, when you have adequate intestinal probiotic levels already present. So how do many of us end up so deficient or lacking in these healthy bacteria that are supposed to be in our intestinal tract normally? Well, any infection, viral infection, bacterial infection of our GI tract usually causes significant diarrhea, loose stools, and that affects the balance and the gut permeability. Stress, any kind of stress. Poor diet, typical American diet, unfortunately, in some cases. Use of antibiotics. Even the astronauts have been shown to have less probiotics when they come back from a mission in their intestinal tracts. Who knows what that's related to, whether the stress of the mission or other issues. So what came first, the IBS or the deficiency of the probiotics? It's important to understand that we currently believe that a select subset of people who have IBS seem to benefit from probiotic treatment. Not everyone. It does seem that in some undefined mechanism, the deficiency of good healthy bacteria in the gut may lead to a low level of inflammation in the intestinal lining that is not detectable by any current technology or tests, and could set the stage for IBS or inflammatory bowel disease, colitis. Most researchers and doctors feel that there are many factors, including genetic makeup of the individual and how they interact with their environment. Namely, how well we handle the introduction into the body of foreign substances in the foods we eat via the GI tract. There have been studies that have demonstrated, breath test studies that have demonstrated in IBS patients small bowel bacterial overgrowth. And today, some of the articles are suggesting that if we use an antibiotic in those patients, we can actually improve symptoms. And some of the studies are showing that. I think that the antibiotic is appropriate to be used in certain cases. However, not without the probiotic. If you're going to use an antibiotic to help suppress the bad guys, you've got to put in some of the good guys. So by itself, I don't think that's the whole answer. And again, that's just my opinion.